Welcome to our guide on all-on-4 dental implants, a revolutionary solution for those seeking a full set of teeth with maximum efficiency. Watch on to see how it can bring you the smile of your dreams.
First of all, before we do any kind of surgery, we take impressions to our patients so we can see how's their mouth outside of, and we can see what we can do. After that, we take a 3D scan on our patients. Sometimes we just see the models and, oh yeah, I can place implants. Sometimes it's not that way. Maybe the gum is very big, maybe their bone is very thin. So what we need to do, we need to make a plan, a treatment plan. On day one, we see them like 8:30 in the morning. We take the models, we take impressions, and we have or it depends on how many arches they're gonna do. If it's just one, I can do all my planning in about 2 hours. I do my planning in about 2 hours and I can start the surgery. The next day, I can place the temporaries if it's just one. If it's two, I just start the surgery on the next day very early, and then at the third day, he has his temporaries just to go back home. Tell my patient, sometimes it depending on the structure of his bone and the pressure that we can place, the torch we can place to our implants, sometimes we can place something we call immediate loading. What is the immediate loading? The immediate loading is something we can place after the implant, right away the next day. So we take impressions, we send them to the lab, and they make a denture attached to your implants without a roof on the plate and just like a horseshoe for temporary. They look really nice, they're comfortable, and they're like temporaries. After that, after the 4 months of healing, we take impressions again and we have the final word. But certain times our patients, or they have certain disease like diabetes or high blood pressure, we don't take the risk to make them immediate. For also with our 3D scan, we can measure how strong the bone is. In our machine, it's like a stoplight, yellow, red, and green. If our 3D scan show us the bone that it's red, we just let it stay. We let our implant stay there for about 6 months, and without immediate loading, just temporary dentures that you can put it in and put it back and clean them for about 6 months. I know sometimes it's uncomfortable, but well, it's gonna be the best option for certain patients.
Get a great smile with Dentavacation. Visit a hand-picked dental clinic today.